Kia ora, thanks Bex. And Simon, I'll pass the baton to you, sir.
Kia ora, Ross. I keep using the pass the baton thing between the Public Health Agency and HNZ all the time, so I'm glad you've picked that up. So kia ora everybody, I just checked sound check all right. My name's Simon Everett. I'm the Director of the Public Health Agency establishment, so there is some extra set of hands to help get the agency on its journey. Just before we get going, I'd just like to acknowledge it's actually been 2 years since the Whakaari White Island disaster today, and I just reflecting on it, I was in the thick of it in a leadership role at the time, and so I just want to acknowledge those that lost their life, those whānau that were seriously injured, and just a shout out to the community of Eastern Bay, both the hospital team, Whakatane Emergency Department, and the wider iwi and community response that came after that. So just to acknowledge that today, given its 2-year anniversary. So yes, the Public Health Agency is one part of the system that's being described here. So I'm going to go into a little detail about what our thinking is and where we're up to with our what I've called a design and build process, because we've essentially had to build it out of the ashes, which has been a really interesting experience. And to share with you some information on kind of the vision, the purpose, and what we're currently working on. I guess what I'd really just like to acknowledge as Rob, Sharon, and Chris and Beck, some of the aspirations of the new system are certainly the aspirations of the Public Health Agency, and how we bring those to life over the next the next couple of years is going to be really critical. And I think the key bit for me is going to come down to relationships, the relationships between the different parts of the system, and then how we reach out to our communities and really, as Sharon has said, make sure that whānau voice is really front and centre. Thanks, I'll just take the next slide. I've got a couple of slides to share with you. So I just wanted to share a little bit about the Public Health Agency and some of the sort of components of it. As I've said, we're in the early stages of getting up and running, but I just want to shout out and acknowledge, I think, the relationship with the Māori Health Authority as we grow and develop in the public health space is going to be really critical. And as national public health services start to come online also, how we're really working together and passing the baton, as Ross said, between each other is going to be really critical. We've picked up the vision around Pai Ora, which won't be a surprise to anyone, and I think that's the vision of the health reforms, and really thinking about what's the role around public and population health, and how can the agency really help and deliver in that space. One of the couple of sort of features of the Public Health Agency, the agency's it's described as a distinct branded unit sitting within the ministry. So it's going to be like a directorate, and we'll play a key stewardship role in that public and population health space. And some of the functions, there are some new functions coming into the agency which feel really exciting, but that really strong focus on population health and public health policy, strategy, regulation. Just picking up on Sharon's point around intelligence, surveillance and monitoring functions as a whole area of development across the public health system, where we're really looking to pull together that expertise and really think about how we can use that in a different and meaningful way to inform really good actions. The agency also is going to play a really key role around public health leadership of the system, and is obviously the Director of Public Health Office, and you've seen a lot of our Director Carolyn McElnay the last couple of years, but that leadership role in the system and how that can really be enhanced going forward. Some of the sort of things that I've been really excited about, and that I've heard Sharon and Rob talk about, is the kind of building of Te Treaty principles in a practical way into the DNA of the Public Health Agency. So we've really been thinking about, right from the start, how do we make that meaningful? And I just want to acknowledge Graham Cameron, who's online, who's recently come on to help give us advice and support in that space. And that's been really helpful to think about how do we really start off in the right and meaningful way in that space. Acknowledging Chris's points around equity needs to be a key focus of the Public Health Agency. And again, thinking about population health approaches. One of the, I think, really great opportunities coming up is really thinking about how do we shift some of the determinants of health and really in a meaningful way have a strategy and policy lens firmly on those things, and really put the challenge out there about, how could things be different going forward. There's a new kind of Section 11 committee, which I just want to mention, which is the Public Health Advisory Committee. So why I think this is important is it's a voice up to ministers and to government. So that's both upwards and downwards. So that feels really important. That committee is just in the process of coming to life, and there's going to be an expression of interest process for membership in the new year. So I think, again, thinking about all of you that are out there living and breathing public and population health, how do we make sure we get the right voices on that committee to really be informing government in a meaningful way? So the things that I guess I'm really encouraged about, the building blocks of the Public Health Agency that we really are really mindful of and trying to think about around the treaty components, the equity and population health influence we want to have over the system, and really thinking about those wider determinants of health and how can the agency play a leadership role working with Māori Health Authority and HNZ in that space. So we'll just go on to the next slide. Just finally, just a couple of points. I was told I only had 3 minutes, so it is a speed dating with the PHA today. So just some of the, kind of give you an idea of where some of the things are up to. As with HNZ and the Māori Health Authority, we've called ourselves an interim agency, and we're really taking this time between now and July to do the design and build process. So we're aiming for a date of 1 July to be up and operational. I started in September as a team of 1, so we're about a team of 15 now, but we're still going to grow over the next few months, and really thinking about that investment into those areas that are going to allow us to make the system shifts that we need to, which feels really good. We've done some development around what we've called Pou Whirinaki, and there's a beautiful story that sits behind that I won't have time to go into today, but that's about being really clear on our why are we here as an agency, how do we fit into the broader system, and it's that concept of weaving a cloak and how the different parts and strands come together as part of a broader system. So we're just mindful of trying to get our vision and purpose right. We're advertising for a new Deputy Director General of the Public Health Agency, so to replace me, the permanent person to come along. That closed yesterday, and really excited to get the right leadership in place in the new year. So there's a real opportunity there. And probably just a couple of other things in terms of next steps. Sharon, just to acknowledge your presence, but the relationship with the Māori Health Authority feels really important from the agency's point of view, and we need to have some time together. And as Becca's mentioned too, the National Public Health Services are coming into being in the new year. How do we really join up and make sure we're singing from the same songbook? Doing the work around our operating model, our resources, people and structures, and then starting to think about our work program going into July next year. So I guess I talked about what are the things that excite me. I've always been a big fan of population health, and it just feels, as Rob has talked about, a once in a decade, if not lifetime, opportunity to do some different things in the New Zealand health system. So that feels really exciting. And I think picking up Chris's challenge, you know, how can the system really meaningfully respond in a different way? And so I take that challenge on board, and I think that's something we need to do as a central government agency, to really think about our behaviour and how we can respond in a different way. I just want to do a bit of a shout out. We're very lucky to have a Director General who's a public health physician. So I just want to acknowledge Ashley's leadership in the public health space, and also acknowledge Minister Verrill, who has been such a strong advocate for public and population health and continues to drive such a strong agenda across the system. So that's probably it from me. I realise my information is probably a bit more into the detail and operational, but just wanted to give you a sense of where the agency's up to, and really look forward to hearing your thoughts and ideas. Kia ora, everyone.
Kia ora, Simon. Kia ora, Bex. Thank you both. And as many of you know, our life and COVID, Zoom has made many things more challenging, but it has made one thing a little easier. And one of the things that's a little frustrating for people in face-to-face hui is when you're then all asked to get up and change tables and sit with somebody new. We are about to do that with you, and it's going to be fully automated and a lot simpler. So one thing that Zoom's made easier is this. So from here, you'll shortly receive an invitation to join one of the workshop groups. All you need to do is accept that invitation. You'll then find yourself in a separate Zoom digital space. There's a facilitator there. At the end, we'll be asking you, the facilitator will guide you through a discussion around key things that we must hold on to, the good that's in the system that must be preserved, the great practice we see, things we'd like to let go of, and then key new things, new opportunities, new possibilities that we could introduce. We won't have time at the end to report back in this forum, but there are note takers in each of the workshops, so everything you share will be captured and will continue to help inform the work from here. So you've had the great framing from our board members, from Simon, from Bex, and it's a really strong invitation here to draw on your experience, your expertise, and together with your creativity now to give us your advice, throw ideas into the mix, examples, and really enter that aspirational space of where the future of public health could go. So keep an eye out for the invitation coming up. The workshop will run approximately 20 minutes and we'll connect together back into the main forum to close up approximately around 20 past 2. So have fun, be robust, be enthusiastic, bring ideas, expertise, and appreciate your time with us. Look forward to seeing what comes out of the next discussion. Kia ora koutou. Joining the workshops with us, and just appreciate that. For myself and Ross, we weren't able to get around all the workshops. We were able to hear some of the dialogue that was going, and looking at things that we need to keep for the future, things that we might want to let go of and change, and other new opportunities to introduce. And so what I'll do here is, as a facilitator has been invited to pop some of the headlines from those threads into the chat, have a look at those together as they come through, and I'll just take a couple of moments to talk to where to from here together, and then we'll pass back to Mātua Tau shortly to close out our forum together with us. Really appreciate that today in One Hui together we'll feel, and particularly in the interactive time in the workshops, it will feel like you've probably had the opportunity to start to skim the surface. Ideally, it's really important to us that this becomes and feels like very much an ongoing conversation together. So we appreciate the time available today to start to frame that conversation. There's a shared working group underway that's currently been framing up this work, shared between the transition unit, DPMC, and colleagues like Bex and the team, myself and others who you've heard of, and then the ministry as well, so Ross and some of the others. That work and that shared working group we'll start to capture all of the outputs from today and then start to pass that into the work of the new entities and that shared future work from the Public Health Agency, Māori Health Authority, and the Health New Zealand board that will pick that up in the future. And so noting some of the comments and the headlines coming through, we can see today emphasising the need for clarity around terms like pai ora and equity, picking up some of the challenge that we've had from Chris, and several tautoko remarks regarding the definition for equity and starting to unpack that together, noting themes regarding workforce capability, and you may be aware that we've been in other parts of the reform work on a series of national road shows regarding the reforms, and the theme of capacity, sorry, not capability, the workforce capacity is a really key recurring theme and concern for others. So the other key themes that are starting to come through in the comments there is the need for flexibility, that the frameworks can be so rigid. So just want to acknowledge the expertise, experience that you're bringing to this, and as some of the highlights you can see here, the full notes of the facilitators will be captured and shared with that group as we go forward. So just in wrapping up then, all of this will help us start to shape our thinking for a public health component of the system that, to Sharon's most beautiful words, can act as the conscience of the system, and to pick up the framing from Chris, where we have a system that will no longer fail to know its audience. Your input will help us achieve that together, and we hope that you'll continue to join in the conversation with us together, whether you're interacting with the bald white guys like Ross and I, or the very diverse team that you've seen, and that diversity will need to only continue to grow Thank you for your time with us. It's a real privilege to draw on your expertise and experience, and we look forward to the ongoing conversation. What I'd like to do now is to just pass our baton again, so to speak, back to Mātua Tau to close as appropriate in karakia together. Kia ora mātua. Thank you.
Kia ora tātou, ko te mea tuatahi mihi atu ki a kōrua mo tō mahi rangatira. He wanganui o mātou, mo tō mahi I tō kaha. He mihi atu ki a koutou mo tō ngākau. Hey, first and foremost, I'd just like to thank you, Carl and Ross, for your leadership work and guiding us through this space. It's been absolutely wonderful. Thank you very much. E mihi atu hoki ki a koutou, nā koutou e whakamana te tangi o te ngākau o Te Hiringa Hauora ki a koutou, ki te neke mai ki a mātou, ngā mihi atu ki a koutou. Secondly, I'd just like to thank everyone that's attended. So thank you very much from the heart, the Māori of the heart of Te Hiringa Hauora, that you have heeded the call of the tangi to draw near to us to be part of this. And thank you. Thank you for your richness. You don't usually thank or acknowledge your leader, but I do that anyway. I'd just like to acknowledge Tāne Mahuta Cassidy for all his vision and his work, and that he's done for the kaupapa, for Te Hiringa, for the kaupapa of Paiora, for all of us, and opening up the space all the time for us all to be able to stretch our minds and to stretch our hearts and come together. Mihi atu ki a koe tāne. Reraka ki a koutou hoki ngā kai kōrero I hara mai ke wanganui a mātou, mihi atu ki a koutou mo tō matatau, tō mātauranga hoki. So to our presenters that have enriched us with your knowledge and helped us stretch our thinking, I'd just like to take this time to acknowledge you. So me karakia tātou. Nō reira e tua te atua me ngā tūpuna. Ko tēnei te mihi whakawheta atu ki a koe. Nā koutou e uhia mai ke runga ki a mātou tō kaha, tō manaakitanga, tō wairua. Awhi o mātou whānau I rote te hohi pera. Awhi o mātou whānau I rote te whare here hoki. Kia rātou ngā rawa kore. Kia tātou katoa. Awhi mai o mātou whānau. Humai te manaakitanga kia tātou katoa. Anō reira, tūruki, pāneke, tūruki, pāneke. Hara mai te toki, haumi e, hui e, tā ki e. Kia ora tātou. Ngā mihi.